I'm Dr. Seeta Ramamurthy Pal, and I'm one of the fetal medicine consultants working at the Institute of Fetal Medicine, Kolkata. Today we are going to be talking about Down syndrome. Down syndrome is basically a syndrome where there is an extra chromosome number 21. Now this is a chromosomal defect when normally all human beings have 23 pairs of chromosomes, and each chromosome occurs in pairs. And if any of that chromosome number is increased, that is in Down syndrome especially, the chromosome number 21 is in 3 numbers. So that is why it is also known as trisomy 21. Now when this happens, there are a lot of things that can happen to the baby. That is, the baby might have structural problems like heart defects or absent nasal bone or other problems. But most importantly, these children are intellectually disabled, and they have some element of mental retardation, as we call it. The way of looking at Down syndrome is the risk of chromosomal defects, especially Down syndrome, increases with increasing age. But it doesn't mean that only the women who are above the age of 35 will have it. It can also happen in women who are younger in age, that is below the age of 35. And overall, we say that the risk of having a baby with Down syndrome is around 1 in 1200. Now, Down syndrome is one of the most common chromosomal defects, and that is why we want to screen these pregnancies for the fetus who are at high risk of having Down syndrome. Most of the times the babies look normal in the sense they may not have any structural defects, and that is why it is not very easy to pick them up on routine ultrasound scanning, and that is why we do certain other tests which may help to identify whether the baby is at risk of having Down syndrome or not. Now it is totally up to a couple whether they want to undergo these tests, because though Down syndrome is there is no treatment for it. And just because the baby has Down syndrome doesn't mean that we want to abort the pregnancy or end the pregnancy. There are many children who have Down syndrome and who have done very well in life and who are actually have success stories behind them. So it is totally up to a couple to decide whether they want to undergo screening and whether they want to do anything if the test comes back as positive. But we always recommend the screening because it helps to sort of screen the pregnancy and also prepare the couple and the doctor as to what can be expected from this pregnancy. So Down syndrome screening can be done in the first 3 months or after 3 months also. It's better if it's done in the first 3 months because it is much more sensitive, and then we can do tests if necessary to confirm whether the baby has Down syndrome or not. So the tests that are done are usually a blood test where we look at certain biomarkers, as we say, in the blood to check whether this fetus is at high risk. And along with that, we also do an ultrasound between 11 to 13 weeks to see if the baby has any features which might suggest that the baby is at risk of having a Down syndrome. These are not confirmatory, and that's why they are called screening tests. So we look at certain features like nasal bone, nuchal translucency, and other features in the ultrasound, and we look at certain biomarkers in the blood, and all together we put it in a software, and that will give you a risk whether the fetus is at high risk or low risk. If it comes back as low risk, then we are very reassured. But if it comes back as high risk, we can do an invasive test where we put a needle inside the uterus, take out the fluid that is around the baby, or take a tissue from the placenta, which is the chorionic villus, and then that will give us 100% confirmation whether the fetus actually has Down syndrome. Nowadays, we have another blood test called the non-invasive prenatal testing, which is a blood test done on the mother, and it is very, very sensitive to detect Down syndrome, but it is still a screening test. It does not confirmatorily tell whether the baby has Down syndrome. So when all these things are available, we usually recommend and offer all these tests to the couple, and it's up to the couple whether they want to do it or not and take it forward if the test comes back as positive. We are always there to counsel the couples regarding it if any doubts, and what steps need to be taken further, and what happens if the test actually comes back as positive. Thank you.